Dr. Ghatan, what can we do when we have those boils, those like, yellowish, reddish passes somewhere on our, wherever? How dangerous are they? How can we get rid of them?
Well, we are seeing more and more of these things, and we are seeing this because there is resistance to some of the antibacterial products that we have available. It's called MRSA. MRSA is methicillin-resistant infection, and we are seeing a lot of that nowadays. And it's basically a collection of pus under the skin. You see redness, you see sometimes yellowish pus, you may have some pain. Fever may come at a much later time, but sometimes multiple of these on different parts of the body. It may have to do with some body hygiene, people who don't take care of their hygiene properly, or people who tend to sweat a lot, they wear very tight clothing, they tend to sweat underneath, or people whose immunity is a little bit on the low side, and they're much more prone to get this infection. Obviously, antibiotics are important in treating these things, but more than that, it's important to open these boils, or what we call abscesses, and get the pus out. Once you do that, then antibiotics are going to work much better. I tell the patient, look, as long as you have this boil, this abscess, it's like you're having a wall, and the antibiotics cannot penetrate the wall to take care of the infection. You're going to have to break that wall, get the pus out, let the antibiotics take over after that. And that's the main thing that needs to be done. I tell them, if you cannot reach a doctor, try to put some warm compressor on. Not too hot, not to burn yourself, but if you put warm compressor on and off, it sometimes helps to open the boil, open the abscess, and to get the pus out. And until the time that it comes, you can go to the doctor. We do see people who have cysts. Cyst is a growth that people get. It's usually benign. It's not dangerous, not cancerous, but it can get infected. Usually, it looks like a growth that has a little central pore in it, and it can be in some parts of the body where it's more prone to get infected. We all have bacteria on the surface of the skin, and from time to time, the bacteria can overgrow and get inside the cyst, and then the cyst gets inflamed and infected and forms into a big abscess or big boil. And that also needs to be addressed. Then we numb it, we open it up, we lance it, and get the pus out, and that takes care of it. There is a different situation, similar, which is quite painful and quite uncomfortable, where the patient gets basically a boil in the rectal area, in the back. It's called pilonidal cyst, and that would be very painful. Patient can't sit, can't stand. It's very uncomfortable. A lot of times that happens because, especially people who have a lot of hair growing in that area, the hair tends to grow inside, and there is a reaction to that hair by the body, and then there's some bacteria on the surface that gets in somehow, and then there's infection that sets in. Again, that has to be numbed, opened up, get the pus out, and give the patient antibiotics, and they bless you because the pain is gone. Right, then you take that pus out, and they can see it and go about their business.
So basically, we're talking about small operational procedures to take care of it. It's just kind of like what needs to be done.
Right.
Okay. All right. Good. Thank you very much.